You trust your healthcare providers.
Yeah.
But have you ever really stopped to think about how they make sure the care they're giving is actually, top quality and safe? It's more than just smart doctors and nurses. There's this whole system working behind the scenes. And a big part of that is something called internal quality assessment, or IQA.
That's exactly right. I mean, external accreditations, they're important. They give that stamp of approval. But the real day-to-day engine for getting better, that often comes from these internal checks.
Okay.
So today, we're going to sort of pull back the curtain on IQAs. What are they? Why should you care about them for the treatment you get? And importantly, how do hospitals and clinics actually do them?
And to really get a handle on this, we've looked at quite a few sources. We're talking big names like Joint Commission International. They set standards globally. And the National Accreditation Board for Hospitals and Healthcare Providers, NABH.
Right, and also insights from ISQA, the International Society for Quality in Healthcare. Plus, we found a really interesting podcast specifically on IQAs and some other detailed readings on the topic.
So our goal here, our mission for this deep dive, is pretty simple, really. We want to give you a clear picture, a really good understanding of how this internal work happens and why it's so fundamental to the quality and, crucially, the safety of your healthcare.
Yeah, we want to go beyond just the surface level, show why these assessments actually matter more than you might realize.
Okay, let's dive right in then. What is an internal quality assessment? Like in plain English.
Okay, simply put, an IQA is basically a systematic way for a healthcare organization to look in the mirror, to evaluate itself.
Right.
It's a deep look at their own processes, their services, how they do things day to day, and they measure all that against certain standards.
Standards like what?
Well, things like government regulations, their own internal targets or goals, and recognize best practices in healthcare. The key thing, though, is that it's internal, driven by them, for them, not some outside body coming in to audit for a certificate.
So it's definitely not just about, checking paperwork is filed correctly. It's much bigger than that.
Absolutely. Much bigger. The scope can be really wide. It can cover everything from, the core clinical processes, how conditions are diagnosed and treated, right through to how efficient the back office administrative functions are.
Okay.
It looks at patient safety rules, the actual quality of care given, how well resources are used, are they wasting time or money, and are they actually following their own policies? All of that can fall under an IQA.
Wow. Okay. That sounds incredibly comprehensive. How do they even begin to tackle something that broad? What are the sort of key pieces of an IQA?
Yeah, it is complex, but there are key components. The very first step, and it's critical, is defining the scope. They have to decide what specific area they're going to focus on for this assessment. They can't boil the ocean all at once,
Makes sense.
So maybe they'll look just at how medications are given out, or the patient discharge process, or maybe even how they manage their supplies. The focus usually comes from their bigger quality goals, like where do we know we need to improve?
Okay, so narrow it down first. Got it. What's next?
Next up, they need to establish the evaluation criteria. These are the actual yardsticks they'll use. Measurable standards.
What kind of yardsticks?
Could be national clinical guidelines, maybe standards from those accreditation bodies we mentioned, like JCI or NABH. Or it could be their own internal policies, very detailed ones. Or even just accepted best practices from the wider medical field. Without clear criteria, the whole assessment becomes subjective, right?
Yeah, you need something concrete to measure against. Okay, so they have the scope, they have the criteria.
Yeah.
Then what?
Then comes the real information gathering, data collection and analysis. This is where they collect the evidence to see how they're actually doing compared to those criteria.
How do they collect that data?
Lots of ways. They might send out surveys asking patients like you for feedback or asking their own staff. They could do interviews, talk directly to doctors and nurses about how things work. They definitely do document reviews, looking through patient records, checking policy manuals, and sometimes direct observation. Just watching how care is delivered. The whole point is to find the gaps. Where are we falling short? What needs fixing?
Okay, so they gather info, spot the problems, and then just tell people to fix it. Is it that simple?
Not quite. The next step is crucial. Providing feedback and developing action plans. Finding the problem isn't enough.
Right.
They need to share those findings constructively with the teams involved and then collaboratively create real, concrete plans to address the issues. Who does what, by when, what specific changes need to happen.
And how do they make sure those changes actually happen and, stick around?
That's the final piece. Follow-up. Quality improvement isn't a one-shot deal. They need to circle back later, reassess, Did the plan work? Did things actually get better? And, really importantly, are those improvements lasting? It's a cycle, really. Assess, act, reassess. That's what drives continuous improvement.
Okay, that makes sense as a process. But let's connect it back. Why should someone like me, just wanting good healthcare, care about all this internal stuff? How does it directly impact my care?
Oh, it impacts your care in several really fundamental ways. First off, IQAs ensure compliance.
Compliance with what?
With regulations, with accreditation standards like JCI or NABH, with their own internal rules. By constantly checking themselves against these, they're building in safeguards. It protects you, the patient, from potential errors and makes sure there's a baseline of quality and safety. Think of it as them double-checking the safety net.
Okay, so it's like meeting the basic requirements, but hopefully it goes further than that.
Oh, absolutely. It has to. IQAs are also a huge driver of continuous improvement. Healthcare isn't static, right? New research comes out, best practices evolve.
Sure.
These internal assessments push organizations to keep up, to adopt better ways of doing things. So the quality of care you receive today should hopefully be even better tomorrow. Without this internal push, things could just stagnate.
Yeah, nobody wants stagnant healthcare. What else?
They're also really good at finding operational gaps. Things that might not seem directly related to your medical treatment, but really affect your experience.
Like what kind of gaps?
Maybe inefficiencies in how patients move through the system, long waiting times, or redundant paperwork, or bottlenecks in getting resources like equipment or tests. Fixing these makes the whole experience smoother and less frustrating for you.
Okay, so it makes the whole machine run better, which is good for me.
Precisely, and probably the most direct impact. IQAs are key to enhancing patient care and safety, period. By systematically looking at their clinical practices, their safety procedures, they can find those specific areas where a change could lead to better treatment results for you, fewer complications, a safer environment overall. That's the absolute core.
Better outcomes, safer care. That's the goal, isn't it?
It really is. And one last point, by involving their own staff in this whole process, they build a stronger culture of quality. When the nurses, the doctors, the technicians are part of finding problems and figuring out solutions, they're much more invested in making things better. Everyone feels responsible for giving you the best possible care.
Okay, I'm sold on why it's important. Now let's get practical again.
Yeah.
How do they actually do these assessments effectively? What are the steps involved in, say, a hospital setting?
Right. It usually follows a pretty logical flow. Step 1, as we touched on, is define the scope and objectives, but with real precision. So not just improve safety, but something like reduce patient falls in the orthopedic ward by 20% in the next year. Clear boundaries, measurable goals. That focus is key.
Very specific. Got it. Step 2.
Step 2 is develop clear evaluation criteria. And again, these need to be measurable and based on solid evidence. If they're looking at, say, how heart failure is managed, they'd use the latest clinical guidelines from cardiology groups.
Right.
If it's infection control, they'd use established standards. These benchmarks ensure the assessment is objective and rigorous.
Makes sense. You need that solid foundation. What's step 3?
Step 3 is select the data collection method, or usually methods plural, the right tool for the job, essentially.
So what kind of tools are we talking about?
Oh, like we mentioned, patient surveys are great for getting your perspective on communication or satisfaction. Interviews with staff can dig deep into how a process actually works on the ground. Document reviews, checking charts. Policies are vital for verifying compliance. And observational audits, watching things in real time, are perfect for assessing things like hand hygiene. Often, they'll use a mix to get the full picture.
Okay, using different angles to get the information. Then step 4 must be looking at that information.
Exactly. Step 4. Analyze the data and identify gaps. They take everything they've gathered and compare it against those criteria they set earlier.
Right.
They look for trends, outliers, any place where performance doesn't meet the standard. And crucially, they try to figure out why. What's the root cause of the problem? Just spotting an issue isn't enough.
Okay, find the problem, understand the why. Then step 5 is about fixing it.
Yes. Step 5 is provide feedback and develop action plans. This means sharing the findings constructively with the relevant teams. Then, working together, create those detailed plans. What actions are needed, who's responsible, what's the timeline, and importantly, how will we measure success?
Actionable steps. And the final step to make sure it all works.
The final step, step 6, is monitor progress and reassess. Like we said, it's a cycle. They need to track if the plan is being followed. Then, after some time, do another assessment, maybe smaller, to see if the actions actually worked. Are things better? Are they staying better? continuous vigilance.
That whole process sounds thorough. Can we maybe walk through an example, make it a bit more concrete?
Yeah, absolutely. Let's take a classic one. A hospital wants to improve hand hygiene compliance among its staff. Super important for preventing infections, right?
Definitely. So how would they use IQA for that?
Okay, so step 1, scope. Focus on hand hygiene practices across all inpatient units. Step 2, criteria. The hospital's own hand hygiene policy, which is probably based on WHO or CDC guidelines, wash before and after patient contact, etc.
Got it. Standard stuff. How do they collect data? Get survey for that easily.
Right. For this, observational audits are key. Step 3 would involve trained, and usually anonymous, observers watching staff during routine care. Did they clean their hands at the critical moments? They'd record the observations systematically.
Okay, so observers collecting the raw data. What might they find in step 4, analysis?
They might analyze the data and find maybe compliance is generally okay, but it dips significantly in really busy areas, like the emergency department or during night shifts. Perhaps doctors have lower compliance rates than nurses in this particular instance. They identify specific problem areas.
So they've pinpointed the weaknesses. Step 5, the action plan.
The action plan might involve targeted training sessions for ED staff and night shift teams, maybe installing more hand sanitizer dispensers in high traffic zones, perhaps a reminder campaign, posters, screensavers, and assigning hand hygiene champions on each unit. Clear responsibilities, clear goals.
And step 6, the follow-up.
They'd schedule follow-up observational audits, say, 3 months later, and then 6 months later, specifically looking at those problem areas and roles. They'd track the compliance rates. Hopefully, they see a significant improvement.
And the outcome for the patient.
The outcome for you is potentially huge.
Yeah.
Fewer hospital-acquired infections, better safety. It's a direct link from that internal process to your well-being.
That really brings it home. Okay, so reflecting on all this, what are the absolute key things you, listening, should take away about these internal quality assessments?
I think first, it's crucial to appreciate the importance of those clear, relevant evaluation criteria. That's what gives the assessment teeth. Without solid, evidence-based benchmarks, it's just going through the motions. The standards have to be meaningful.
Right, and it's not just about the paperwork or the standards themselves.
No, not at all. Engaging the staff is absolutely vital. When the people doing the work are part of finding the problems and crafting the solutions, those solutions are just so much more likely to work in the real world and actually stick. Their input is gold.
And it's definitely not a one-and-done thing.
Absolutely not.
Yeah.
Continuous monitoring and follow-up are non-negotiable for real, sustained improvement. Healthcare quality isn't a destination you arrive at. It's an ongoing journey. Regular checks make sure improvements last and new issues get caught early. It keeps everyone focused on giving you the best care.
And it's probably good to remember those organizations we mentioned earlier, like JCI, NABH, and IQAs. Their standards often form the basis for these IQAs, especially in accredited hospitals, right?
Exactly. Those external bodies help set the bar high and provide frameworks that guide these internal efforts globally. So if an institution is accredited, it suggests they have these kinds of rigorous internal processes in place, which should offer you some level of confidence.
Okay. So, wrapping this up, it seems pretty clear that internal quality assessments, these IQAs, are really a core function within healthcare organizations. They might happen behind the scenes, invisible to us as patients, but they represent a huge ongoing commitment to making sure the care you get is safe and always getting better. Yeah, and just understanding that this happens, that this internal scrutiny is going on, can maybe help you feel a bit more empowered, a bit more informed as you navigate your own healthcare. It shows a commitment to quality from the inside out.
Definitely food for thought. So knowing that hospitals and clinics are constantly evaluating themselves internally like this, what other questions does that spark for you about how quality is actually measured, how it's maintained, and ultimately how you experience it? Something to ponder as you go about your day.